Ascaris lumbricoides, the giant intestinal roundworm, the largest and most common intestinal roundworm parasitizing the human intestine. Geography. It's got a worldwide distribution and highly prevalent in areas with a warm, moist climate from 20 to 30 degrees C and poor sanitation. It is the most common helminth infection in humans. Approximately 807 million to 1.2 billion people are infected. And this map gives you an example of areas of the world where it's most likely found. Adult morphology. The adult worms are creamy to pinkish white in color, cylindrical, tapering at each end. Males are 15 to 30 centimeters in length by 2 to 4 millimeters, while females are larger at 20 to 35 centimeters in length and 4 to 6 millimeters in diameter. The male tail curves ventrally with 2 spicules. The worm has a striated cuticle or skin with 2 lateral lines. Life cycle. The worms are in the small intestine, and the female lays eggs about 240,000 per day and an estimated 87 million in a lifetime. The eggs pass through the intestine and out with the feces. The eggs embryonate. The larva develops within the egg in about 10 to 14 days under the right conditions, the right moisture, temperature, and shaded soil. The embryonated eggs are ingested. They hatch in the small intestine. The larva penetrates the intestinal mucosa, and it enters the blood and is carried to the liver and lungs. The larva remains in the lungs for about 10 to 14 days. They penetrate the alveolar wall and migrate up to the respiratory tract, to the throat, where they're swallowed, and passes back into the small intestine, where they grow to maturity. Eggs are produced in 60 to 75 days post-infection. The female adults may live up to 1 year. Disease. The migrating larva can damage organs. They are more pathogenic if it becomes erratic and migrates to the wrong place. Erratic ascariasis, which is provoked by illness, fever, anesthesia, and some medications. Erratic adults migrate out the nose, mouth, they perforate the gut, and they can be fatal when the worms migrate into the vital organs like the liver, lung, and brain. With heavy infections, hypersensitivity may develop, with eosinophilia, pneumonitis, cough, etc. This is known as Loeffler syndrome. Now, a few adult worms are essentially no problem. A bolus, or a large number of worms that block the intestines, can cause a twisting of the bowel. This can be very serious. Heavy infections are associated with malnutrition and with poor nutrition. You typically have more worms. Pica, or the eating of unusual things like dirt, can lead to very heavy infections. Eosinophilia, or increased numbers of peripheral eosinophils, can be seen. And migrating worms usually cause eosinophilia, so you should always suspect worms with elevated eosinophils. Diagnosis. Finding eggs in the feces by direct examination of feces or after a concentration method. The diagnosis is relatively easy because of the large number of eggs produced. You may find larvae and adults in the feces. Now, there's 3 types of eggs that can be found. 1. The regular fertile eggs. They are thick-shelled with an outer mammillated coat. They are approximately 45 to 75 microns by 35 microns. Then you have the decorticated fertilized egg. These have no mammillations, and these are about 30 by 40 microns in size. Then you have the unfertilized egg. They're irregular in shape. They are about 40 by 90 microns. There's many techniques to detect eggs and feces: flotation, concentration, Cato thick smear, and others. Treatment. Many antihelminths are available. Ivermectin, mebendazole, and albendazole are all used to treat Ascaris lumbricoides. These drugs are also likely to be used in mass treatment campaigns. Epidemiology. In unsanitized endemic areas, most of the children have ascariasis. The prevalence rates decrease with age, and they're found equally in males and females. Children defecate indiscriminately and spread eggs in the soil. Places that use night soil to fertilize vegetables, you may get infected with eggs in the leafy vegetables that foster infections. Night soil is another term used for using human feces for fertilizing your crops. Poor sanitation and favorable climatic conditions and a constant seeding of the soil with eggs perpetuate infection. Eggs are resistant to change in climate, chemicals, etc. They can live in the soil for 3 years, 4 years in the refrigerator, and 5 years in weak formalin. Control is difficult without changes in defecation habits. There are really no animal reservoirs of Ascaris lumbricoides. Control, 3 steps: improve sanitation, mass treatment, health education.